Okay, so we'll do a series here that starts out on your side. It's a stabilization series for the side body, obliques, gluteus medius, and the lateral stabilizers of the hip. We might throw a little bit of shoulder in there too. We'll see how it goes. So join me on your mat, and if you've already done this part, you can skip ahead, but just lying on your side, relaxing, we can feel how the belly, adipose tissue, organs, your lunge, whatever, will sink and might even pull you a little bit forward towards the ground, right? So just get the feel of that, and then engage your muscles to pull in. You might even notice that that lifts up the underside of the waist a little bit so that you're not necessarily resting on your mat so much as you're stacking your hips upright, hugging abdominals in. Now, of course, you can do this with a co-contraction of the small muscles at your back, or lumbar multifidi muscles, those smaller stabilizers that keep you from rounding your back or totally flattening out, right? So hugging your waist in here, and then make sure, like I am, that you're still breathing. You could even talk, carry on a conversation with that hugging in action. Before we add anything else, we want to have that down. So next, let's go ahead with reaching through the top leg, and already there's a little bit of like a wobble that wants to happen, so I'm going to firm up perhaps just a little bit more around the midsection, hugging my ribs close to my hips a bit, because otherwise I do have a tendency to let my ribs kind of pop forward. So we're holding here, and you could do, as I'm doing, just hover your leg in about horizontal. Hold there, feeling the strength through your midsection and the lateral hip. And there are many different varieties of training the lateral hip. I'll share with you one of my favorites, just a simple bend and stretch. This is harder than it looks. This bending and straightening of the knee is something that we use all the time in functional movements. You can imagine you're going up and down stairs. You would want to have some stability through your core so that you maintain balance. But after doing just a few of these, you should feel in this plane, working against gravity from this direction, that this is not as quad intensive, but much more lateral hip intensive. And of course, we need those muscles to help stabilize so that the leg isn't pulled down with the force of gravity. So you'll take just enough of those that you feel like, yeah, okay, I did something here, work those muscles up. Don't keep going to the point where you're starting to lose a lot of stability or lose your form. So let's put the legs aside for a moment. Keep the core muscles going at a low level, just enough to hold you together. Engage the scapular stabilizers as well. And then perhaps even take a little weight. We'll reach up towards the sky and then lowering down to the front. Now, oftentimes what happens when we move an arm or a leg, if we're not stabilizing really well from the center, is that we'll get kind of like a counterbalancing movement. So if I were to tip back here, it would offset the movement of my arm forward. And of course, you don't have to use a 2-pound weight as I am. You could use the weight of your arm. You could use a slightly bigger weight, but keep in mind we're focusing more on stabilization here than on the bigger muscle groups. So you'll stay probably under 5 pounds. All right, so that's about all I can do today before feeling like other muscles, maybe in my neck or elsewhere, are trying to help out. So that would be a common compensation, other muscles trying to help. So we'll just take this on the other side, but I'm going to show you a different variation. And this is incorporating the use of the stability ball. Clearly, this is going to require more neck stabilization because I've got less support now from the floor underneath me. It's a wobbly ball. I also have less support for head and neck, so I'm going to be mindful to keep chin tucked in, so cervical stabilizers are engaged, abdominal stabilizers engaged, and I am going to use my bottom hand to support some of the weight of my head. So we'll go back to that, lifting the leg at about hip height or in line with the rest of the body, and simple bend and stretch, right? And you might see the little wobbles that happen. Little wobbles are fine. If you feel like you're falling off the ball, you might not be ready for this one yet. In that case, go ahead and go back to lying on your side on the mat where you'll have a little more stability. So no rush in your progression, right? Work where you're at and aim for really good control of your muscles, good stability and endurance before you pick up the pace. So before we close this one today, I'm gonna add the two together, give you an idea of what that might look like. So knee bent, arm up, and then arm forward, leg reaching long. You might even inhale here and exhale as the arm reaches forward, leg reaches beside me or even just slightly back behind to get even more from the glute med. Inhale up, exhale, of course waist muscles still working a bit. And let's do maybe two more of those. I'm not much of a numbers person, I'm more of a feel it person. So if you're feeling like, okay, yeah, I worked pretty hard with that and got the target muscles that we intended to, then you're all set. You might take a second set, but studies have found that the first set is where you get most of your strengthening benefits. So I hope that felt good in your body, and I'll see you soon for more evidence-inspired practice.